Have you ever wondered why some people experience extreme mood swings, from feeling extremely high to incredibly low? This is often more than just a simple change of mood. It's a sign of a complex mental health condition known as bipolar disorder. Bipolar disorder is characterized by significant mood swings that include periods of mania, where individuals feel extremely euphoric and full of energy, and episodes of depression, marked by feelings of intense sadness and a lack of motivation. These shifts can be so extreme that they interfere with a person's ability to function in their daily life. Why is this topic of interest? Because bipolar disorder affects approximately 1 in 50 people worldwide. It's not just a rare, abstract concept, it's a real prevalent issue that many people grapple with every day. Understanding bipolar disorder not only helps us empathize with those affected but also potentially recognize symptoms in ourselves or others around us. So what causes these extreme mood swings? Bipolar disorder, like many mental health conditions, doesn't have a single identifiable cause. Instead, it's usually a combination of several factors that contribute to its onset. These factors include genetics, stress, and brain structure. Let's dive a bit deeper into each of these. Firstly, genetics play a significant role. If you have a parent or sibling with bipolar disorder, you're more likely to develop the condition. However, it's important to note that most people who have a family history of bipolar disorder will not develop the illness. So, while genetics can increase the risk, they're not the sole determinant. Secondly, we have stress. Major life changes or traumatic events can trigger episodes of bipolar disorder in people who are genetically predisposed to it. This could include anything from the death of a loved one to the loss of a job. But again, stress alone doesn't cause bipolar disorder. It's how our bodies respond to this stress, coupled with our genetic predisposition, that can lead to the onset of the illness. Finally, let's talk about brain structure. Research has shown that the brains of people with bipolar disorder may differ from those without. These differences could affect how the brain functions and processes emotions, leading to the symptoms of bipolar disorder. But remember, our understanding of the brain is still evolving. And these findings are just one piece of a much larger puzzle. So, we see that bipolar disorder is likely caused by a complex interplay of genetic factors, stress, and brain structure. It's not as simple as pinpointing one single cause. Each of these elements can increase an individual's susceptibility to the disorder, but it's usually their combined effect that leads to its manifestation. This complexity is why it's so crucial for us to continue researching and understanding this disorder. By doing so, we can better diagnose, treat, and support those living with bipolar disorder. While we cannot pinpoint one single cause, these factors contribute significantly to the onset of bipolar disorder. Now that we know what causes bipolar disorder, how can we identify it? This question leads us to the crux of the matter, recognizing the symptoms, which is crucial for early diagnosis and treatment. Bipolar disorder typically manifests through episodes of mania and depression, each presenting its own distinct set of symptoms. During a manic episode, individuals may experience a sudden surge in energy, feeling invincible and capable of accomplishing anything. This heightened energy can also translate into a reduced need for sleep, with individuals often staying awake for extended periods without feeling tired. Furthermore, people may feel unusually high or euphoric, which can manifest as an overly cheerful or outgoing mood. However, it's essential to understand that this isn't the regular feeling good most of us experience, but rather an over-the-top happiness that can quickly escalate into irritability, rapid speech, and racing thoughts. On the flip side, during a depressive episode, individuals may experience feelings of emptiness, sadness, and hopelessness that seem to envelop them, clouding their outlook on life. They may lose interest in activities they once enjoyed, and struggle with feelings of worthlessness. Sleep and appetite changes are also common, with individuals either sleeping too much or too little, and eating more or less than usual. It's worth noting that these symptoms can vary in intensity and duration among individuals. Some people might experience mild symptoms, while others might have severe episodes. And while some may have several episodes a year, others might only have a few throughout their lifetime. Understanding this pattern of fluctuating moods, from manic highs to depressive lows, is key to identifying bipolar disorder. It's like a roller coaster ride, with the individual experiencing extreme ups and downs that can disrupt their daily life. Remember, recognizing these symptoms can be the first step towards seeking professional help. It's always important to consult with a healthcare provider if you or someone you know is experiencing these symptoms. They can provide the necessary guidance and take steps towards effective treatment. Bipolar disorder is often misunderstood. What are some common misconceptions? Let's dive into this. It's a common belief that those with bipolar disorder can't lead a normal life. This is not true. Many individuals with bipolar disorder are leading happy, fulfilling lives. They're working, studying, raising families, and contributing to their communities. It's important to remember that bipolar disorder is a condition that can be managed with the right treatment plan. Another misconception is that bipolar disorder is a rare condition. In reality, it's more common than you might think. Globally, it's estimated that about 1 in every 100 people may have bipolar disorder. That's millions of people worldwide. So it's not as rare as many believe, and it's likely that we all know someone who is affected by it. Then there's the myth that bipolar disorder is just about mood swings and everyone has those, right? Wrong. While it is true that everyone experiences ups and downs, the mood swings in bipolar disorder are extreme and can significantly impact a person's life. They are not just everyday changes in mood, they can last for weeks or even months and can be so severe that they interfere with a person's ability to function. Lastly, some people think that those with bipolar disorder are dangerous or unpredictable. This is another misconception. People with bipolar disorder are not inherently dangerous. In fact, they are more likely to be victims of violence than perpetrators. It's vital to understand that this disorder does not equate to unpredictability or danger. These misconceptions can lead to stigma and misunderstanding, creating unnecessary barriers for those with the disorder. By debunking these myths, we can foster more understanding and empathy. We can help create a society that supports those with bipolar disorder, rather than marginalizing them. By debunking these myths, we can foster a more understanding and empathetic society. Let's continue this conversation and work towards a world that is more informed about bipolar disorder. Bipolar disorder can be challenging, but it's not unbeatable. How can it be treated? The journey to managing this condition often involves a combination of medication, psychotherapy, and lifestyle changes. Let's start with medication. This is typically the first line of treatment for bipolar disorder. Mood stabilizers, antipsychotics, and sometimes antidepressants are commonly used. Mood stabilizers can help control manic or hypomanic episodes, while antipsychotics may be used if symptoms persist despite the use of mood stabilizers. Antidepressants, however, must be used with caution, as they can sometimes trigger manic episodes. Next, we have psychotherapy, often regarded as an essential component of treatment. Cognitive behavioral therapy can aid individuals in understanding and changing thought patterns that lead to problematic behaviors and emotions, while family-focused therapy helps to enhance the support system around the individual. Another approach is psychoeducation, which empowers individuals and their families by providing them with knowledge about the disorder. Of course, it's crucial to recognize that medication and psychotherapy are not the only aspects of a comprehensive treatment plan. Lifestyle changes can play a significant role as well. Regular physical activity, a healthy diet, adequate sleep, and avoiding triggers such as alcohol and illicit substances can make a substantial difference in managing bipolar disorder. A noteworthy point is that treatment plans should be individualized, considering each person's unique symptoms, co-occurring mental and physical health conditions, and personal circumstances. Therefore, it's vital to seek professional medical advice when dealing with bipolar disorder. Remember, this is a long-term illness that requires ongoing treatment, and the path to stability may not always be smooth. There may be periods of trial and error while trying to find the right combination of treatments. However, with patience, perseverance, and the right support, managing bipolar disorder is entirely achievable. With the right treatment and support, individuals with bipolar disorder can lead fulfilling lives. We've covered a lot today. Let's take a moment to summarize. Our journey began with unveiling bipolar disorder, a mental health condition marked by extreme mood swings from high to low and vice versa. We delved into the causes, which are a mixture of genetic, environmental, and neurological factors, and then transitioned into recognizing the symptoms, which range from manic episodes of high energy, reduced need for sleep, and loss of touch with reality, to depressive episodes of low energy, low motivation, and loss of interest in daily activities. We also debunked common misconceptions about bipolar disorder, reminding ourselves that it isn't a rare condition, nor does it signify a split personality. Lastly, we discussed various treatment options, emphasizing that with the right medical intervention and continuous support, individuals can manage their symptoms and lead fulfilling lives. Remember, understanding and empathy are key when it comes to mental health. Stay informed, stay supportive.